Hello and welcome. I'm DrPoonamsvlog and let's talk today about a very important topic, that is the symptoms of early childhood cancers. This question was asked to me by Mandeep Singh on my social handle. So what is a pediatric malignancy? Pediatric malignancy means cancers in children in the age group of 0 to 19. Yes, 0 means even a newborn baby can have cancer, okay, till 19 years of age is called pediatric malignancies or pediatric cancers. Though it's a very small number in the whole burden of cancers, nevertheless childhood cancers, if diagnosed and treated in early stages, okay, these children who are cured of cancer can have a productive life as an adult, and therefore they should be given fair chance for cure. Now today we are going to touch upon these symptoms which may alarm the parents, and the parents should watch for this so as to visit their pediatrician and doctor for further confirmation. Okay, these may be non-specific signs as well as specific signs. What are non-specific signs? The non-specific signs are those signs which may be missed even by a layman and sometimes even by healthcare practitioners. It may be missed because they occur in so many other diseases that we cannot for sure say that yes, this is present and it may be malignancy or cancer would be the last diagnosis. So the non-specific signs are called a non-specific because of this reason that they are present in many other conditions. Now what are specific symptoms? So specific symptoms are those symptoms wherein you just can't neglect. You have to take your child to the doctor. You cannot wait for long here. So what are these non-specific signs? So there are multiple. Now let's jot down one after the other. Okay. First one is unexplained weight loss. Now unexplained weight loss may be because of loss of appetite, loss of taste, or in spite of having good food intake, the baby is losing weight and the weight loss is almost more than 10% of the previous body weight. Then we need to be cautious. Second is unexplained fever. So it would be an unexplained high grade fever of more than 102 degrees Fahrenheit or 39 degrees Celsius with chills, rigors, and sometimes night sweats. Now what does chills mean? So chills means feeling of cold. That sometimes when we get cold, हम बोलते हैं मुझे ठंड लग रही है. Okay, I'm feeling cold. That's chills. And what is rigors? Rigors is when a baby with fever, many of you must have seen, when a baby with fever starts shivering like this, okay, the limb starts shivering like this, that is called a rigors. Okay, so these chills and rigors and night sweats, when they are present, it may be indicative. At the same time, even moderate fevers of 100 to 103 degree Fahrenheit or 38.4 to 39.7 degree Celsius, which is lasting for more than 2 weeks, can also be indicative of malignancies, and any baby with more than 1 to 2 weeks of fever will definitely undergo all investigations which will be geared towards malignancy detection also. Third one is unexplained malaise. Now what is unexplained malaise? That the child is just irritable for unknown reasons. Secondly, signs which are suggestive of weakness or physical inactivity in a child, because children are usually physically active, but when they become physically inactive and with a lot of weakness, then you have to be alarmed. Fourth is sudden loss of appetite. A sudden decrease in appetite in otherwise normal baby who was otherwise eating well, okay, and this decrease in appetite along with other signs which I have told earlier and which I will be telling later on may be a symptom, though it is not very indicative. Fifth is a pallor. Pallor means appearing whitish. We have these children have the palm, sole, their lips, their eyes, they look a little bit pinkish, okay, so this is the normal pink color of the babies. But when it starts looking whitish, it is called a pallor. So the whole baby will start looking a little bit dull, little bit pale, little bit whitish when you see. Okay, this is called pallor. Along with that, the hair will lose luster. So it will be a lusterless hair. It may be a rough hair. So this may be symptoms of anemia, which may be associated with cancer, especially blood cancers. And also in this there will be a weight loss or no weight gain in baby. So a proper weight gain may not be there, or a weight loss may be there along with the anemia or the pallor or paleness in the baby. Sixth is bruises. Now bruises are very common in babies because they fall every now and then, but a bruise, a minimal bruise causing a lot of bleeding, or secondly multiple bruises on a baby's body without trauma, there is absolutely no trauma, and suddenly the baby starts getting bruises, one here, one there, then you have to be careful. And third is unexplained nosebleeds. They can be also an alarming sign. Seventh is delay in growth and milestone. Now consider a baby who is otherwise born normal, had everything normal, like normal weight, normal birth, normal development, normal growth, everything was normal till a point when suddenly the child loses interest in surroundings. They are not developing any further, or there is regression of the growth, that is whatever milestones they have achieved, that also they are not doing now. Like a baby who was standing has stopped standing, a baby who was otherwise sitting has stopped sitting, or the baby who was turning on either side has stopped doing that, or stopped using one side of the body. Then you have to be alarmed. Eighth is decrease in immunity. That is, a child who is falling sick every now and then, is having multiple hospital visits, was admitted for some disease which had improved, and then again the baby is suffering from the same disease. Then we have to be cautious. We may have to look into the why the baby is having low immunity. Is it because of an underlying cause of cancer? Ninth, the skin's manifestations. So skin manifestations are called peticulae. They are called peticulae. So what is peticulae? Is the small red like dots which will appear on the body, and they will not disappear. Like when you get allergies and all, sometimes those red spots come, but when you press them they just disappear. Whereas in peticulae, the peticulae will not disappear, because peticulae is basically small bleeds. That is, blood is accumulating under the skin. This is called peticulae, and it indicates basically problem with the blood, such as platelets and all other elements of blood. Now these were the non-specific symptoms. Let's go to the specific symptoms, that is red alert. You have to go and visit the doctor. Now these are further divided into four. One is the nervous system, that is something to do with the brain, okay, those cancers. The second is your bones and the soft tissue, that is bones and soft tissues is basically your muscles and all other part, okay. The third is your eye, okay, and the fourth one is your blood and your lymph nodes. So these are four things wherein you will see certain symptoms which are actually visible to the parents if you observe closely. So let's go through them. So the nervous system symptoms may present early morning headache with the vomiting in a baby, or weakness on any part of the body, especially the limbs of the baby. Like they will not be able to lift their hand, leg, may not be able to walk properly, which they were otherwise doing, may not be able to hold things properly, which they were otherwise doing. Second one in the nervous system would be uncontrolled body movements, which are called seizures. So seizures are something, it's baby is unconscious and they start moving this way, like the eyes will be rolled up and they will start moving this way. So this is called seizures, okay. The third one is imbalance in movement. So they may not be able to have the balance when they are walking. They will lose their balance while walking, maybe on one side, or they will sway while walking, okay. And the next one is slurring of speech. So the child who is otherwise talking properly may suddenly develop a slurring of speech, which is a red alert symptom. Maybe you have to go visit, not maybe, you have to go and visit the doctor. The next one is cancers of the bone and soft tissue. So cancers of bone and soft tissue may present as abnormal swelling which is just growing rapidly in any part of the body. It may be some bone, it may be your tummy, it may be your back, it may be your bones, hands, legs, it may be any part of the body, okay. And it is growing fast, it is painless, and it is firm means if you touch it you find that it is harder, okay, and it's not moving. So the firmness and the movement, usually your doctor will see. What you are going to see is there an abnormal swelling which is just growing and it is painless, and baby had no fall, there was no problem with it, suddenly the swelling is developing, then you have to visit the doctor. Next is repeated fractures. Repeated fractures may be one of the symptom, as well as severe bone pain and joint pain also should alarm you. Now next, go to the eye. Now rapid change in the vision, that is what you say power of eye or the power of the glass number. A rapid change in the vision can be one of the symptom. Also unexplained bulge in the eye, that is swellings in the eye. Sudden onset of blindness. Then sudden onset of squint. Now what is squint? Squint is when your eyes are not looking straight, but they are either looking this way, that is in the middle, or the other way, like how I will show in this picture, and the source I have mentioned in my description section or in the picture itself, just under the picture itself. Okay, so when the eyes are either looking in the middle, that is towards the nose, or the eyes are looking away from the nose. Okay, this may be a symptom of an underlying tumor in the brain, which is affecting the eye. White eye reflex is one more symptom, or the white pupil. Now when you usually shine a torch in the eye, what you see is the black one small black round. This is the white of the eye. Then there is the round, which you can see as black, but it is dark brown usually in most of the people, or black. And in the center of that you will see one small hole, which is called pupil. So when you shine a light in that, usually it is seen as black, but in certain babies you will see it as white, and that can be a symptom of an underlying cancer. So one of the symptoms is the white pupil reflex. Next is symptoms of blood cancer. So symptoms of blood cancers usually will be either a noticeable one will be a lymph node which is seen. Okay, one more is the pallor, which I told earlier, or the paleness in the body. So what is this lymph node? Lymph nodes are these small swellings which you will mostly see in the neck. Many parents come with these swellings in the neck of the baby. Okay, so mostly see in the neck. But when they are worrisome, they are usually more than 1 centimeter. They are very firm. They are hard. They don't move properly, or they may be multiple lymph nodes which are there, and they may be present in the neck, in the armpit, or in the groin area. Now groin area is the area of your body where your thigh meets the tummy, or the thigh meets the abdomen, which looks like this. This is the groin area. Okay, so swellings may be present in this area, and they, as I said, would be firm, painless, but your doctor will see them. If you notice any lymph nodes, you go and show your doctor. Second one will be the lever, which is enlarged. So lever is in your right side, just below your rib cage. Okay, an unexplained fullness in the tummy may be a liver which is enlarging. So be careful if you find a liver or the tummy of the baby a little bit bloated than normal, and without any reason the bloating is present, it may be a sign you have to go and show the doctor. So these were in nutshell all the symptoms that you should take care of, or you should keep a watch on. And if you want to know more in details, because I have just told the symptoms that you should know, because I think parents should know this thing, but though there will be many people who will be interested in knowing more, you can go to this website, okay, www.knowdisease.com, to know more details. Okay, I will place this link even in my description section, and you will know your information which is scientifically proved, but in a simple layman language. Okay, if you like this video, please do thumbs up, follow me, subscribe to me, and follow me on all my channels. Okay, that is YouTube, Facebook, and my Instagram. I'll be making more interesting topics like this, and many more things coming up. Please support me so that I can give the information to you. Bye bye.